In this slide, we would discuss about the intervention for the homeless for their health needs. To identify the homeless patients and their family, the risks for their health needs is a priority. Outreach visits is most likely the first contact with the homeless patient. So during the initial clinic visit and in the clinic or in the physician office, the staff should demonstrate general interest, empathy, respect in a warm, non-frightening, and non-judgmental environment. The goal is to address the symptomatic problem first and treat with simple guidance, and that will have a visible impact on the patient's life. This will help to establish confidence and mutual trust and encourage the patient to return to physician's office. Once the trust and rapport is established, visit can focus on identifying an emergency contact and discuss patients' more challenging social, medical, and mental health problems, and even the end of the life issues. And many times, while we are attending to the healthcare needs for the interventions, bear in mind that the basic needs for food, clothing, and housing in this population may have higher priority than healthcare. So the nurses and the healthcare workers can refer to homeless population and recommend for social service, food resources, food banks, housing department, for shelter, for the homeless shelter also. And regarding the intervention for the medical condition, for cardiovascular disease, their care can be followed up by the doctor, nurses, and case manager and medication regimen. Mental and substance abuse, there should have enough screening and treatment and supportive services, and eventually, if they can obtain the stable housing and employment, that would help them a lot with their mental health and reduce chance of substance abuse. Regarding the cognitive disorder and brain injury, this is more complex and it requires a multidisciplinary approach for assessment and treatment and follow-ups. And injury and violence, there should have trauma-specific interventions and to assess people who are in domestic violence. They need referral for shelter or for women protection, child protection services, and for infection disease, preventive measures such as vaccination, regular checkups, and to give them masks and help them education of social distancing, especially in the COVID pandemic. For the skin and food problem, they would be follow up with education and give them products for skincare and also provide footwear or give them education how to do food examination. And because the homeless are out there, so they are exposed to extreme and heat and cold, so when they present with symptoms in the emergency room or clinics, symptomatic treatment will be rendered, and education will be given for them to be avoiding exposure to heat or cold. With the homeless families, they also, besides the preventive primary care, the homeless family need help to access to the secondary and tertiary care as well. So that would be also require multidisciplinary team, the doctors, nurses, pharmacists, and social worker, and also other healthcare workers to help them to be able to access to all these cares.